The Rural Comprehensive Care Network and Southeast Physicians Alliance strives to provide high-quality medical care in rural communities. They are committed to helping to provide physicians and hospitals in rural Nebraska high-quality and accessible healthcare services. We are proud to offer this great opportunity for you to serve in rural Nebraska.
Hi, I'm Dr. Jason Besplitz, and I practice here in Geneva, Nebraska at Fillmore County Medical Center.
My name is Paul Udemark, and I am the CEO at Fillmore County Hospital.
I'm Dr. Lucky. I'm in David City.
I'm Dr. Mike Sullivan from Aurora, Nebraska.
I am Dr. Matt Summers, and I've been practicing in David City since 2007.
I like practicing in rural Nebraska because you have the benefits of a rural area, but yet you have access to specialists that come to our rural hospital, so you're not isolated.
I get to know all my patients very intimately and on a personal basis. I see them not only here in the clinic, but out in the community.
My wife and I both grew up in rural Nebraska and have had the opportunity in our careers to go places outside of the state. And at the end of the day, we found that being in rural Nebraska is a great place to live, a great place to raise a family.
I grew up in rural Nebraska, so that's the biggest reason why I always enjoyed the rural atmosphere.
And I wanted to raise my children in a rural lifestyle if possible.
We could let our son, out in the yard without really too much supervision. Of course, there's hardly any crime here in rural Nebraska.
I think in a small community, your relationships are stronger and deeper than they would be in an urban setting. And when it comes to delivering health care, I think that's something people value, is that personal relationship and that knowing one another and being part of the community.
For me, it's the scope of practice. I think that in rural Nebraska, you basically do it all. So we do emergency room, we do in-hospital care, we do clinic care, we do obstetrics, and we do some surgery. So it's a wide scope of practice. For me, that's what I like. That's what I came here for, and that's what I've been able to do for a long time.
When I first went to medical school, I wanted to be a surgeon, so I wanted to do a lot of hands-on things. And so with my training in family medicine, I got some extra training to do some scopes, and I do my own C-sections, I do a postpartum tubal. And so here in the rural area, I get to do all those things where my counterparts that are practicing in the city don't get to do those type of procedures.
We get to see all sorts of different things, all sorts of different pathology, do a lot of different procedures, and really be involved with our patients from birth to end-of-life care. So that was a big reason of why I chose family practice and being in a rural community specifically.
Sometimes in a rural area, the patients you see become close friends, and so they are more than just patients. You're truly a family physician that is helping take care of your friend and your friend's family.
The long-term relationships are really what's important to me. Right now, my obstetric load is basically all people that I have delivered when they were born.
I really enjoy doing the procedures. I enjoy seeing patients in the emergency room. I enjoy the clinic, of course, but I also enjoy taking care of patients in the hospital.
I think call is part of the game. If you don't want to do call, maybe you don't want to do rural practice. But it comes with the territory.
We have 4 PAs that are in our practice that act as hospitalists, and so they take and rotate the first call. And so the 3 physicians that I have here in my practice now, we just take backup call, and it seems to work out very nicely for not only for the PAs but also for the physicians.
We have several specialists that rotate through that come into our hospital that do both surgeries and just consultations with patients. I mean, we have a very good relationship, I feel anyway, with our specialists.
Within our community, there are opportunities for spouses of physicians to work.
We've never had a problem here in Geneva finding work for the spouses that have come either for our physicians or for our mid-levels?
I think that we're fortunate in David City to have a very good school system, and certainly there's 2 different school systems, and so people have variety and choice of what they want.
I really believe that the schools do measure up in rural areas. In fact, I think in many ways they have advantages. I think that in rural areas that the community knows the students, and they also have many opportunities to participate in lots of activities. There's many activities provided, opportunities provided in rural schools, and because of the limited number of students, there's actually encourage students to participate in a lot of them, and many times that can build a sense of community and school pride, and also give them the opportunity to expand their educational horizons.
When we start to recruit another partner, we look for a physician that is versatile in what they can do.
Someone who relates well to people.
Certainly a commitment to family medicine, a commitment to the rural community.
Wants to take care of people here, that is not afraid to take care of their patients in the hospital.
We start out basically looking for candidates who share common values with rural Nebraskans.
So when it comes time to look at practices, I would give rural Nebraska an opportunity, as you have a wide variety of options that you can do without restrictions, and the lifestyle is unbeatable.
I think this is something that you can do where you can actually make a difference in people's lives, and they certainly do appreciate that.